We want to give the world access to a super useful technology that really has the potential to transform healthcare and in particular remote diagnostics in fascinating ways. Dsruptive Subdermals is a company specialized in implantable microelectronics. We are particularly focused on tiny injectable chip implants that don't have a battery. The way they work is that you inject them under the skin, and then when you want to do a reading with using the sensors of the implant, you just swipe on the outside of your skin with your smartphone. That activates the implant, it does a reading, and then the data is transferred to the phone. In this way, we want to enable people to read their vital body parameters at any time and in any setting, really.
The purpose of this study is to compare temperature measurements via this new subdermally implanted device compared to traditional temperature measurement techniques. In a subdermal implant, you have a much more consistent environment, the sensor is in place and it's inside the body.
So I have 2 implants that are temperature sensors that measure my body temperature.
I have one in my stomach and one in my right arm. There are very small chip implants, roughly the size of a rice grain.
It's very easy to read it. You just basically swipe your phone over the chips.
The installation was actually fairly simple. I almost didn't even realize it was put in until it was done.
Anyone who's used to tweezing their eyebrows or hitting their small toe on something, that's so much worse.
I go into the app. I go to read temperature. So I'll just open it up. And there we go. Now it says 33 degrees is the abdomen sensor value. And it's that simple.
This should be the way to find problems in your body and help you live longer and healthier.
I wanted to be part of the study to make sure that we are moving towards a more technical and advanced society.
Potential clinical applications for this type of device is home monitoring, for instance. In an outpatient clinic situation, you could use implants to have a much better surveillance of the patient.
Our technology is both cheap and robust, as has a very long lifetime. We think it can be valuable for millions and millions of people. We have set the ambitious goal that we'd like to see 1 billion people implanted by the year 2030.